Good afternoon, good morning, good evening, depending on where you're connecting from. My name is Lisa Wad. I am on behalf of the population at the United Nations Economic Commission for Europe, delighted to welcome you to today's Policy Dialogue on Aging. The dialogue is organized by the UNECE Standing Working Group on Aging, which is UNECE's intergovernmental body that fosters regional cooperation on aging. And with this event, we wish to create a space for exchange between governments, civil society, academia, and all of you present today. So thank you so much for joining us for this event. Our policy dialogue on aging today is co-sponsored by partners of the Joint Program on Aging for Eastern Europe and Central Asia. We have an ongoing collaboration since 2020 with organizations from the UN family and civil society working on aging, notably UNFPA Regional Office for Eastern Europe and Central Asia in Istanbul, the WHO Regional Office in Copenhagen for Europe, the Office of the High Commissioner for Human Rights, HelpAge International, and the NGO Committee on Aging. And together we join forces and pool resources whenever possible to raise awareness in aging, to build capacity, and to provide technical assistance for aging-related policy in Eastern Europe and Central Asia. So thank you, dear participants, colleagues, and friends, for joining us today for this discussion on preventing and addressing violence against older persons. We've organized this event as a side event to the Regional Forum for Sustainable Development that's going on in Geneva this week. And it is a contribution to SDG 16, which is on peace, justice, and strong institutions. It's one of the development goals that is under in-depth review at the Regional Forum this year. And it seeks to promote peaceful and inclusive societies, provide justice for all, and build effective, accountable, and inclusive institutions at all levels. So we are today far from having achieved SDG 16. In times of war, conflict, military conflict, people across the region and the world are in a situation of omnipresent violence, and the objective that we have for everyone to live a life free of fear and safe in their homes, families, and communities is far from real. So as the human rights of older people are so fundamental to violence, we would like to kick off today's meeting with a statement by Claudia Mahler, the independent expert on the enjoyment of all human rights of older persons, and give her the floor to share with us key messages from her recent report that she presented on the topic of violence, abuse, and neglect of older persons at the Human Rights Council last year. So we will put on a short video message that she kindly provided as she is traveling today and cannot be with us.
Dear Excellencies, esteemed colleagues and friends, I extend my gratitude for the gracious invitation. Regretfully, I'm unable to join in person. The abuse of older persons remains largely overlooked at the national, regional, and global levels. This is one aspect why I dedicated my last report to the Human Rights Council on the topic. It is estimated that by 2050, 1 in every 6 people will be aged 65 or over, increasing the risk of violence against older individuals, with the main root cause being ageism. Manifested stereotypes and discrimination will continue to foster abuse and neglect. Older persons across the world face risk and vulnerable situations, particularly in times of crisis. Despite the graveness of the issue, the response has been inadequate, with insufficient attention on various political and social levels. In Resolution 33/5, the Human Rights Council recalled the issue as a widespread phenomenon that includes discrimination in the public sphere, linguistic and employment discrimination, lack of access, isolation, neglect, financial exploitation, physical and psychological violence, and the withholding of basic needs and physical attacks. Given these challenges, the focus of my thematic report is multi-faced, just like the manifestation of abuse. Psychological and emotional abuse, for example, is the most prevalent form of abuse of older persons. Many older persons globally are at a high risk of experiencing rejection and negative treatment during social activities, as well as negative attitudes like being a burden to the family or society. This emotional abuse might be triggered when relatives or carers do not know how to deal with older persons who need support, and especially those with dementia. It is crucial that states improve their efforts against abuse of older persons by implementing effective prevention and protection measures in alignment with international human rights obligations. In addition, the United Nations Decade of Healthy Aging 2021 to 2030 is another advocacy tool. This includes improving data collection on abuse, enhancing public awareness campaigns, and ensuring the protective services are accessible and equipped to support older victims. Currently, older persons do not have sufficient protection to live free from violence, abuse, and neglect. Furthermore, the multiple grounds of unequal treatment are not considered. A legally protective regime specifically addressing the rights of older persons in international law would help and guide states to effectively prevent all forms of violence in older age. By addressing abuse of older persons comprehensively, the aim is not only to protect the rights and dignity of older persons, but also to foster a culture of respect, care, and support. My thematic report calls for efforts from all sectors of society to create a world where older persons live in safety and dignity. It is our responsibility to ensure a dignified life for the whole life course. I thank you for your attention, and I wish you all a fruitful discussion.
We thank Claudia for her contribution to today's event, and we are copying the link to her report in the chat for those of you who would like to read it. Now, in our discussion today, we would like to focus our attention and your attention towards violence, neglect, and abuse against older persons, and how we can use training in particular and awareness raising to detect violence, protect and support victims, and empower them. And we will hear today from experts and practitioners across sectors and countries. Before we begin, I'd like to encourage you to participate in our dialogue today by adding your questions and comments in the chat. And after our panelists have spoken, we will have a moment to review your questions and get some answers from our experts. So, following on from Claudia, it is now my pleasure to pass the floor to Marie Beaulieu. Marie is a world expert on elder abuse, and she was the chairholder of the research chair on mistreatment of older adults from 2010 to 2022, I believe, at the University of Sherbrooke in Canada, the first of its kind. And we are honored, Marie, to have you with us today to set the scene for our experience exchange with a conceptual overview on the importance of awareness, support, and empowerment. Marie, the floor is yours.
Thank you very much, Elisabeth. So, Excellencies and colleagues, good day from Canada. It's my honor and my pleasure to set the scene for our session that will focus on training as an important means to counter violence against older persons. By training, we raise awareness on a topic that is hidden and lacks visibility in many contexts. By training, we enrich the support that is offered to older adults that experience violence. And by training, we sensitize formal practitioners as well as informal service providers to adapt an approach that fosters self-determination and advocacy of older persons. It's an approach of empowerment. Next slide, please. Older person may experience or be the witness of violence in several contexts, such as wars, massive migration, street aggressions. But violence may also occur in their private life. It can be a lifelong history of intimate partner violence or of new forms of violence or neglect that are committed by persons, groups, and institutions that they trust. Our session is shedding light on what the World Health Organization calls abuse of older people. As we see on the slide, it is also known as elder abuse and neglect or mistreatment of older person. As stated by Dr. Claudia Mahler, abuse of older person can be physical, psychological, material, financial. It can also be neglect. Also, research results and content analysis of public policies show that attention may also be given to sexual violence, spiritual violence, systemic violence, violation of rights, and even to ageism. For example, in Quebec, one province of Canada where I live, older persons have asked the inclusion of ageism in the government definition of abuse because they feel abused when they are the target of ageist attitudes or behaviors. Next slide, please. Abuse of older person is a prevalent problem. It is estimated that each year, one older person out of 6, age 60 plus, living in their home will experience abuse. In institutions, several studies have shown that 2 out of 3 practitioners or workers in those institutions admit that they themselves have been abusive. In the context of COVID, there has been an increase in the prevalence of abuse. We have to remember that abuse is never benign. It has physical, psychological, material, and social consequences that will impair older person for a short time, but sometimes for many years, many months. Therefore, 5 priorities to tackle abuse have been incorporated to the decade of healthy aging. Today, we will address in part 2 of those. The first one is to combat ageism, because this is a major reason why the abuse of older people receive little attention. And the other one is the 4th dot on the slide, the 3rd dot, sorry, develop and scale up cost-effective solution, because I think that training can be a cost-effective solution to counter abuse. Next slide, please. As in other fields, there are 3 steps to intervention in countering abuse of older person. Primary prevention, and the box is larger than the other, is because a lot of time we start there and there's a lot of investment. But it has to be continued by 2 other steps. Good detection and also follow-up. So it's kind of a process going from one to the other. Next slide, please. Prevention can be addressed via policies or programs. These programs can be targeted on violence. They can be targeted on older person. And in some places, we will see policies and programs that will address specifically violence against older person. It includes different strategies, such as adopting public policies, enforcing laws, implementing services. This is the role of governments. It is demonstrated that an absence of policy contributes to the invisibility of the problem. By countering ageism, we are really shaking the roots of abuse. Research results also show that abuse of older person is linked with social isolation. Therefore, all social programs that support social integration, social participation, or social connectiveness contribute to prevent abuse. But we will today put more attention on general awareness and more specifically on training. And why? It's because by doing so, we are contributing to a better informed society and also a better coordinated response to the abuse of older person. Next slide, please. So, first question, who should be trained? In an ideal world, sensitization on abuse would be offered to each citizen. All older people should be aware of abuse. They are the first concern. Plus, each of us, as a citizen, a professional, a family member, should gain of being more informed of abuse. But if I would have to choose by who we start for training, I think we should go with 4 priorities, 4 groups. The first one would be healthcare providers and social service providers. And I listed here a series of them, like physician, nurses, social worker, but also personal service workers, because a lot of time these persons are the less trained, but they spend the most time close to the older person. Second group would be law enforcement. Even though a few cases of abuse are prosecuted, when they are, we see that the system is not always well prepared. So police officers, civil and criminal law prosecutors, and even judges need to be trained. And I did training of judges, and it was really rich as an experience. Thirdly, all the services for victims should be trained to receive older adults. Usually they are trained to receive children, adults, but older adults, they still need more preparation. And finally, I've listed volunteers. Why? Because in many countries, volunteers play a key role in the field of countering abuse. Research has shown the importance of peer programs. And in the field of abuse, several volunteers are themselves retired professional or older person with rich experience that go there to help each other. In that sense, it's very interesting because they are also very concerned. Next slide, please. Why should we train? Well, 2 main reasons. The first one is that older person face a series of hindrances to disclosing or reporting abuse. They don't always realize that the unpleasant experience they're going through is in fact violence or abuse. They are shameful, they are afraid, they don't know where to go. A few studies I conducted with abused older person also shown that some older person feel so weak or paralyzed after the abuse that they don't find the needed energy to ask for help or to report. Secondly, we all know that general wisdom tells us that we only see what we know. Without training to detect the subtleties of each type of abuse, it is difficult to do proper detection. Knowing that a small minority of abused older people will report abuse, we share a moral responsibility to detect abuse. In her research, Anne Nobles, a psychogeriatrician from Belgium, has asked older persons why they never reported that they experienced sexual abuse. Their answer was clear. No one never inquired on the subject, so they didn't feel that it was welcome to talk about it. This result raises a question. Should we train certain practitioners to ask blunt and clear questions on abuse? Even more, should it be, in certain contexts, mandatory to ask? Next slide, please. Sorry for this busy slide, but many things to say here. What should be the content of training? Well, there's a plethora of possibilities when it comes to training format. It can be in person in a class, it could be online, it could be pre-recorded, it could be podcasts, so many things. And training may differ if you're training future practitioners in university or college, or if you're training experienced practitioners who are already in the field working with older person. Training also has to be adjusted to the profile of participants. For example, police officers and physicians need to share a common basis of information on abuse, but regarding intervention, they have to know more about their specific roles. Finally, training, it will be dependent on the time you have to train. I've seen 15 minutes training, which is very short, but I've seen 45 hours of training in university classes. So it's sure you will not cover the same content. So I've listed here a series of modules that could or should be included in training, but due to time constraint, I don't have time to go through all of those. I will insist on 3 of them. First of all, risk factors, which is the third on the list. Research results show that to understand the dynamics of violence, more attention needs to be given to the abuser than to the characteristic of the abused older person. For example, there is a myth on the vulnerability of abused older person. Vulnerability is often a consequence of abuse and was not always pre-existing prior to abuse. The other thing I want to insist on is mandatory response. So the mandatory response is because one of the worst thing that we can do when we detect abuse is not to offer anything after harm. So the victim has nowhere to go. So therefore, it should be mandatory when abuse is reported by an older person or detected that we will do intervention or refer to a person that can do that intervention. And finally, I think it went out of my slide. I'm sorry, maybe I don't have the same format. But my last point was partnership approaches, and I want to insist on that. Research has shown that to address abuse, practitioners need to work on a continuum of services and not in silos. Partnership between public services, private services, NGO services, law enforcement services, and all other actors really need to be reinforced. Next slide, please. My last word is food for thought. It is an invitation to reconsider the approaches developed to target violence. Policies and programs that are looking at children are focusing on protection. Why? Because children are considered as vulnerable. Policies and programs that are working in the field of intimate partner violence, and we have to agree here, it's mainly women that will be the victim of intimate partner violence, will focus more on empowerment because women are considered capable of self-determination. So empowerment is the main approach. Regarding older person, I really suggest that we combine both approaches. Why? Because it is ageist to state that all older people are vulnerable. No one wakes up on the morning of their 60th birthday and say, today I become a vulnerable person. Therefore, we need a balanced approach between empowerment of a majority of older adults that are still capable of self-determination, but also, and we have to recognize that, we need to protect the older person that need protection that are less capable of doing self-determination. So my next slide is just to say thank you, and I look forward to all the examples from different countries.
Thank you so much, Marie, for this excellent overview and for getting us thinking about the importance really of awareness and building capacities through training. And we're now very excited to hear practical examples of how this is approached in different countries. And it is now that I would like to invite our speakers from Finland, Malta, Serbia, and Slovenia to join us by switching on your cameras. And our first speaker is Minna-Liisa Luoma from the National Institute for Health and Welfare in Finland. And she will tell us about an online course developed to stop the violence. Minna-Liisa, the floor is yours.
Thank you very much. So I will tell you about the online course on an example from Finland. So Stop the Violence online course from Finland. So next slide, please. Why we developed online training? Because in Finland, most professionals degree programs do not include domestic violence or violence close in relationships or violence against women or elderly in topics in the curriculums. And we have known that research shows the need of training, and also the Istanbul Convention rigorous training the relevant professionals on domestic violence and violence against women. And it's a tool for organizations as well as for individuals to know what is about when we talk about violence. And it's launched 2019 in Finnish and published in Swedish in the end of June 2021. Next, please. And it's designed especially for professional development of social healthcare professionals and students, and also for the police, because in police it is on the job training. It is also used, for example, by new workers in the shelters for the victims of domestic violence, daycare, schools, crisis center, etc. Also in elderly care homes, some of them who are very more advanced. And it can be found in an website at the Finnish Institute for Health and Welfare. And for example, last year, 3,600 persons has printed the certificate from that they have gone through that training. And it's in a platform, Moodle, and the training is free to use, but account is required, because then they can print a certificate that they have passed the training. Next, please. And the content of the training is it's a very different type of text, different type of videos, audio files, tests, and group talks and talks, tasks as well. And it takes about for groups for 8 to 10 hours to go through the training, and for the individuals, if you go very quickly, it's about 6 to 8 hours. So it's not very long, but very manageable. And feedback is collected to the platform and via email. And like sensitive topics, different ways to understand of the phenomenon, cooperation and discussions between organizations is important. Next, please. And the first module tells what is domestic violence and violence against women. There is the phenomenon, consequences, victims, perpetrators, children, vulnerable groups. One of vulnerable groups is elderly, and about me, myself, and violence. What are my attitudes? The students' own stories, and awareness raising. Next, please. And the module 2, it's duty to intervene. It's basic information about human rights and conventions and violence, like Istanbul Convention, Lanzarote Convention, and also about Finnish legislation, example for duty to intervene, the roles of the different professionals, how important it is then to intervene, and how exchange of information between professionals, and also about victims' rights. Next, please. And the third module is encountering and identifying possible. It teaches you about possible signs of violence, adults and children, how to talk and ask about violence, like as a sensitive subject, and how to talk with the find the traumatized clients, how to intervene, and also the tools available to intervene and help, for example, screening forms, assessment tools, safety plan form, MARAC form, etc. What is available in Finland and where they can be found. Mostly they can be found, for example, in all websites at DHL. Next one. And the fourth module is interpersonal and multi-agency collaboration, which is very, very important in the issue of violence. Why intervening violence requires collaboration? Of course, because we cannot do everything by ourselves, and it is very essential to have a collaboration between the professions. Videos, there are videos, interviews of professionals and introduction of different services in Finland for the victims and also for the perpetrators, which is very, very important also for the elderly victims. And the last point is just say thank you. Thank you for your attention.
Thank you so much, Minna-Liisa. It is very impressive to have not only the course integrated in some of the trainings, but also freely available on the website to be an information resource to anyone who wishes to learn about violence and raise their own awareness. I would now like to invite our next speaker, who is Cynthia Formosa from the Active Aging and Community Care Department in Malta, to tell us about the trainings you have developed and organized in Malta. Cynthia, the floor is yours.
Thank you. I would like to share with you an example of a training we had for some of our workers at the Active Aging and Community Care Department about vulnerabilities in older adulthood. So some background about the Active Aging and Community Care. It's a department which offers both residential care services, but also many services for older persons in the community, such as ComCare, allied health services for housebound persons, handyman service, ComCare service, active aging centers, psychological support, and many others. So the next slide, please. This training was developed as part of the National Strategic Policy for Active Aging, a part of the implementation of the strategy. So we know that there is abuse among older people, but that often it goes unreported and undetected, as Mary was very rightly telling us. So we wanted to develop a training for those employees who usually are not trained about elder abuse. And we included the handyman workers and the home help supervisors. And we wanted the supervisors because they are more stable as a workforce and they go into the person's own home. And the course was later adapted to carers working in dementia intervention team, as well as with the ComCare. Next slide, please. The program was developed in collaboration with the University of Malta, but it was tailor-made for the needs of our employees. It was an aim to increase lifelong learning opportunities for these employees who are in close contact with older persons, because they go into the individual's own home and therefore they can observe more the context where the older person is living, and sometimes the person feels like opening up and talking to these people. So we wanted to equip them with some knowledge about elder abuse to be able to identify it at least. We wanted to sensitize the participants to issues and problems and limitations encountered by older adults, such as material poverty, social exclusion, abuse, cybercrime, domestic and interpersonal violence. And we wanted to enhance these employees' abilities to detect abuse. The concept was not for them to be able to tackle the issue, but for them to come back to the department, highlight this issue, and perhaps other professionals can come in and support the older person, like the social worker, for example, and they can work more on addressing the issue. There were 31 employees in 2021 and 2022. This course was obligatory for all the handyman employees and all the home help supervisors. And for the carers in the dementia intervention team and ComCare, it was optional, and there were 11 employees. Next slide, please. The training was developed in person. especially for the first cohort. Some of them were illiterate and would not have managed to log in on online training. Therefore, it was very important that this training be delivered in person. And in fact, we also stressed the importance with the university that this training is adapted to the skills that these persons are not trained in elderly care, but so the training had to be at a very basic level. Some employees from the second cohort preferred to join online, and therefore it was delivered as a hybrid program. It was a 22-hour duration divided in 11 sessions of 2 hours each. It was delivered at the active aging and community care premises, since most of the employees work there. It was free. It was sponsored by the department. And yes, we stressed with the university because they wanted assessment, but we emphasized it has to be an oral discussion rather than written assessment because that was important for us to enhance participation. Next slide, please. So the course context emerged from the fact that older adults experience aging is very varied, and it's affected by physical, psychological, social, cultural, and financial status. And the training included topics such as old age and quality of life in older adulthood, material poverty and social exclusion, social inequalities. There was also about gender, sexuality, sexual orientation, and ethnicity, and how that affects aging, abuse and domestic violence, interpersonal violence, and victim support. And this was delivered by the interpersonal violence and victim support inspector from the police, and also on cybercrime unit, which is also a section of the police section. Next slide, please. So there was generally positive feedback, more from the home help section, because the handyman section were less used to having training on such topics. But the handyman employees also found interesting the talks, especially from the police, because they were more practical and they could relate to them. So following the training, we were also having seminars, a series of seminars delivered to older persons living in residential care, which are delivered in residential care homes, seminars for older persons living in the community, and also similar sessions for employees at all levels who are working with older adults in the community. And these seminars are focusing mainly on financial abuse and include speakers from social workers, the victim support agency, police officers, the guardianship board in cases of dementia or mental inability to take decisions, and also from the Malta Information Technology Agency. And that's the main points. And thank you for your attention.
Thank you very much, Cynthia, for sharing this. And it really brings us down to some very practical everyday situations that those coming in contact with older people may be faced with, and to provide some guidance on how to address and detect abuse and how to deal with it is so important. Thank you so much for sharing the example. Now let's turn to Serbia and to Nataša Todorovic and Milutin Vračević from the Red Cross Serbia, who will tell us about trainings developed in Serbia and subsequently scaled up to other countries in the region. The floor is yours.
Okay, thank you. We will present our trainings and research, and Milutin will start first.
Yeah, hi, and thanks again for the opportunity to share the experience in regard to training design in Serbia. Yep. So next slide. Yep. So super brief. This is developed through the EU-funded project supported by European Union and Austrian Development Agency called Empowerment of Older Women, Prevention and Violence through Changing Social Norms in Serbia. So And the project was twofold, so to say. So first part of the project was research, because we think that is really essential approach to literally like anything is really to be kind of knowledge-based and evidence-based. So this research part this study has three parts. So one part was desk research around regulations and public policies and laws that regulate the whole field of domestic and then elder abuse as well. Then second was a quantitative study. We were lucky to get the permission from OSCE to get the database from there, like way bigger research on the situation of women in Eastern Europe and in Eastern Europe, like Western Balkans, Moldova, and Ukraine. And we get the data, qualitative data from that study, and we just took the part that considers older women. And we have quantitative study was like 18 focus groups with 150 women from different generations. So we have three different generations, like younger women, middle age, and older women. See like all these kind of different perspectives that come into play. And then especially to have like different insights of how much is widespread this ageistic biases regarding aging that later on can influence the prevalence and the risk of elder abuse. So all this data, consider we published the study, and so we have like two basic aims. So one was actually to advocate for like better regulation and better implementation of the existing regulation regarding especially like older women. So we try to kind of have this kind of intersectional approach to the issue. And then the other part was development of different types of trainings targeting different vulnerable groups. So yeah, next slide.
Next slide. And based on the next slide, based on the result of the research, we have developed and delivered 4 types of training, each targeting different groups relevant for the prevention of elder abuse. First, training of older women. The training sessions are not just about providing relevant information for older women, they are also about empowering them. We feel it is important that older women know that they can address elder abuse, targeting them or someone they know through action, and that this is both their responsibility and granted right. Through this, they understand that elder abuse is not a private matter to be ashamed of, but a criminal activity that must be actively prevented, and that they can play a key role there. Our focus group interviews shows us that some forms of violence are normalized in our society, and training address them. That often prejudice often stop older women from acting. For example, we know that financial abuse is often seen as a normal. Older women think that their children or grandchildren are entitled to handling their pension income because ageist stereotypes say that older persons have fewer needs. This is what we try to disseminate through empowering older women to recognize their own agency in their lives. Second is training for Red Cross volunteers and staff, and for gerontocarers. For gerontocarers is based of knowledge that most elder abuse and especially violence against older women takes place in their home. As Red Cross volunteers and professional carers both frequently visit older women in their homes, we work to equip them with knowledge not only how to recognize possible indicators of elder abuse, but also how to report. Since this is a very sensitive matter, a person reporting violence needs to be careful and keep both themselves and the older person safe while still ensuring adequate support. This is done through cooperation of all relevant community stakeholders. And the training of social workers to recognize potential indicators of different types of elder abuse is also very important, as social workers play an important role in responsibility to responding to violence as well as prevention. This training goes into some detail, not only about forms of violence, but also risk factor as well as type of abusers, and necessary of working with them to prevent further and repeat violence. Social workers represent the government, handle the reports of violence and issue protection and mitigation measures, and therefore have a central role in addressing elder abuse and violence against older women. This training is accredited as a part of the continuation professional education in Serbia. Next slide.
And the last slide as well. So this just wanted to kind of showcase the importance of partnership and how this project, which is like 3-year projects, was able to kind of scale a bit and then amplify a bit and share with other partners that we work with. So the further developments was actually a project that we done with the Red Cross of Austria in Georgia. So there is not much both data and studies on elder abuse in Georgia. So we supported them in developing first quantitative study around the issue in Georgia and developed a training curriculum for staff and volunteers of the Red Cross of Georgia. So that was the first ramification. Second was that we have the similar training, but for Georgia and for the training in Kyrgyzstan, we broadened the scope a bit, so it was on elder abuse more general, but with a focus on older women. After that, we have a similar training held with the support of Kyrgyz Red Cross and Kyrgyzstani Ministry of Social Policy. And so we held that TOT training in Kyrgyzstan. And finally, we were able to use the whole database for the whole region of Western Balkans, plus Moldova, plus Ukraine, regarding the data on elder abuse from this FRA study. And so I think it's really kind of super interesting because you can compare the countries in the first place, and we get some interesting insights that is kind of promising for the kind of further research in patterns of abuse of women in general, but then older women, which is going to highlight this importance of this life course approach to violence. So this is like few ramifications from the study. I think kind of showcasing really the importance of partnership, because it was totally like different funders. So this regional study was supported by UNFPA offices from the region. So it's really, when you have some kind of as a product, it's really kind of interesting the ways you can kind of scale it up with working with other agencies and other partners.
And last slide.
And last slide.
Thank you
guys
very much.
Bye, guys.
Wow, thank you so much. I'm eager to ask questions about the experience from the different countries, but we would have time for discussion later. And this is also a gentle reminder for all participants that you can post any question or comment in the chat. We have one more speaker before we open the floor for the discussion. So now let us hear from Amalia Shiftar from the Slovenian Federation of Pensioners Associations in Slovenia about training of volunteers. The floor is yours.
Hello, also for me, and I appreciate to present what kind of program we have. Our association developed 20 years ago a special program. It was developed by our retired professionals, also with the University of Ljubljana and also with Ministry of Health. So in this program, we started to visit the people who are living alone or lonely, and found out how and in what conditions they live. and what kind of help they need in everyday life. We have also heard bad stories and got a lot of data and inform the authorities with this because this data was useful also for decision makers. We also presented with others, NGOs and experts, these findings and stories to National Council of Slovenia 2007, and the next year the Domestic Violence Prevention Act was adopted in Slovenia. After that, there were started a lot of training for social workers, medical staff, policemen, and other NGOs who are working with old people. Also, our volunteers in this program, Elderly for Elderly, have been briefed on the new law at annual training next year, but it wasn't enough for them, and they don't know how to cope with this when they are visiting old people. So our program management prescribed a protocol for the volunteers' behavior in case of violence in the field. So please, next, this is the slide. So there are 8 points how to behave and how to do in the field. So if we found or detect some abuse when we are visiting old people, then, or maybe they tell about abuse, negligence, or something else, we continue visiting more time. We are empowering them with the knowledge of what are their rights and what are the possible forms of assistance. We are also encouraging them to be more active and how and where to seek help. We also try to establish some health support network for them, and also in this also these volunteers discuss with these problems with their volunteer coordinators in each association where they are acting. But if there is such a hard situation, there is a reporting obligation necessary. We can report the violence in anonymous phone nowadays, or reporting to the social services or police. Even she or he doesn't like to be done, but we have notified the victim what we have done. So there are also the 2 other things we have to do, accompanying the older person if they can do this alone, and at the end, if nothing happened, the interdisciplinary team at the social work center have meetings when we also can participate if it's necessary. These are the tasks written in this protocol. So next slide, please. Now, how to empowering our volunteers and train them in everyday life. So after we defined the annual theme for training, for example, violence against older people, then we started with training of our adult educators. It's top of the top retired professionals who have experience with working with old people. Then they get some new knowledge from the researchers and from the university and other organization in Slovenia, because there are some of them very good. This training takes 1 day for 10 to 12 to 20 adult educators. And after that, we are talking about how to transfer our knowledge to another step. The second level is training of all volunteer coordinators. In Slovenia, it's 243 coordinators, and we put them in 6 groups, and each group spent 2 days with educators and with program management. In addition to training, we also review out our field of work and define the problems we faced. We get also some new knowledge in IT technology and strengthened our team building skills. Then we also discussed about what we need more to the next year, and then we started with training the volunteers in the field with these adult educators and volunteer coordinators. Sometimes we also invite the experts from the surrounding if they have enough time. Next slide, please. So as you see, this is the picture of last year training. At first, our educators explain in plenary session what's the problem, what we have to know, what are the new things, and then they work in the small groups from 6 to 8 people, doing on the real case from the field. After half an hour, when we finish with these discussions in the group, we have a plenary session again, and each group present their case, and they have to explain what they find out, what is the problem of that case, how they can, like volunteers, help them, and what they have to do. If they have some questions, then there are adult educators to help them to find the solution. All our educators are also evaluated by volunteers, and at the end we always ask the volunteers what topics they propose to be on training the next year. Now, after that, we have farewell party and say, see you next year. Please, next slide. At the end, as we know, violence and all these things are never ending story, but in future we need to keep the eye on the new form of violence. For example, as is written, new technology, violence or abuse or or some other violence in this case. We have empowering not only the old people, please next slide, because our volunteers said that we have, with our knowledge, empowered also our grandchildren and make them aware, because sometimes we failed in raising our children, so we have to empower with this knowledge our grandchildren. And it's enough for now, and thank you for listening.
Thank you so much, Amalia, for sharing this very, very impressive program with us. And thinking about the theme of empowerment that has gone through the different presentations, starting with Marie Beaulieu's setting the scene presentation, and then we've seen in the different examples how important it is to empower older persons. But here also, I think what really struck me was the importance of empowering volunteers to act. And as you say, that knowledge then can be passed on and empowers others to see and understand abuse when it's around us, and to know what to do. Now, before we open the floor for the questions from the chat, and I encourage everyone who has a question, a burning question, and hasn't posted it yet to do so, I'd like to take the opportunity to ask one follow-up questions to all of our speakers around this question of empowerment, because it is really a first step in a way when we have, for a phenomena that's often invisible and hidden, to be able to detect and support and help and follow up and intervene. One of the first things that have to happen also, or that would help greatly to be able to act, is that people feel empowered to speak up, that there is a space for seeking help, for voicing what's happening, and someone to listen. So how can we empower older people to address also the shame and the stigma often associated with abuse, as we've heard from presentations, and that prevent victims from speaking up and from seeking help? Maybe you could share your thoughts around that. And maybe we go let's start with Minna-Liisa from Finland.
Okay, thank you. Well, first of all, of course, the knowledge of what is violence is important, but what I think it's also that kind of for example, physicians or nurses, even nurses, if they just systematically ask, I think that's something that we have done in Finland, that when physicians ask, like they ask about smoking a cigarettes or alcohol or whatever, in Finland at least, and then they just ask like a normal thing, and then it is easier people to speak up, because it's not stigmatized, like that they are asking only for me, what is wrong with me or something. So I think that's very important, because if you don't ask, you usually it's very, very difficult to speak up, even if that is very is a serious thing. So I think that's at least one of things.
Thank you. I guess it's also difficult for people to ask, and they need to be encouraged. So if it's a routine question to ask, then, as you say, it can help to become normal. Cynthia, what about what do your thoughts around this question based on Malta and your insights?
I think that providing information to older persons themselves about the different types of abuse and like what Lisa was saying, that you ask them as well, but also providing the necessary support to navigate the system, because if you are a victim of abuse, often they feel like very difficult to navigate the system. And at least in Malta, there are services which can support the person, but for example, if you have the support of a social worker, it helps to navigate better and do reporting the case to the police, for example. And there are also agencies that once you report abuse, they can support you throughout the court hearing, and they provide psychological support and guidance. So knowing where to contact and where to seek help, I think it's very important. And as well for staff to feel safe to be able to report abuse, because sometimes they have difficulty to report abuse because they will be like intertwined in the situation.
Yeah, that's an important point. And it connects back to what Marie was saying at the beginning, the importance also of follow-up and helping, you know, through the different steps. And Amalia, you also mentioned that in the list of topics covered, to help accompany, as Cynthia was saying, if the person so wishes. So maybe Nataša and Milutin, what you mentioned different measures of empowerment, maybe very specifically related to stigma. Is there something that comes to mind? What can be done to help people overcome the fear of speaking up?
I think we need to first be mindful that it is, in most cases, really hard. I mean, you need to, in lots of cases, you need to report your own kids. So that's the hard from the beginning, and it's partly related to stigma, you as a bad parent, etc. Like lots of different things come into play. So I think from the formal standpoint, from the standpoint of the protection, it's super important that all the people get additional support in those cases, which is really going to complicate it. And another issue related to that response really need to be timely and efficient, because if it's not, people will lose the trust in the system and they will not report because they will know that they'll not be supported. So in that regard, we really love to kind of quote the Lord Gladstone in this: justice delayed is justice denied. So if it's not timely, it's even worse than they don't have anything at all. So people will lose kind of faith and will not report.
Yeah.
And as all speakers said, information, education, support through the system, because system look like spider web and people needs to go there and what my opinion is, we need to build to learn how to believe to older person, not two of us or we are the experts, but people who work with older people, they need to learn to believe them when they ask the help.
Yeah, because they're always complaining, kind of idea. Yeah.
Yes. So the importance of the system and of having the supportive institutions that stand behind. I'm just looking at time, and if Amalia and Marie, you could maybe keep your thoughts for later on. If we have time, I'll come back to you. But I would like to now invite Kristen to share with us questions from the chat and see what participants have asked.
Thank you, Lisa. Thank you, everyone. Yes, we've received two interesting questions. Maybe we start with one and see how we're doing on time. The first question is around training within the government. So we've heard about training of health and care professionals, law enforcement, volunteers, but the question that was raised suggests that, you know, there might also be a need to train policymakers and government officials to raise awareness of the issue, and also to highlight possible ageism, unconscious bias within the government, you know, the people that are designing and implementing the policies. So I suppose the question is, are any of you aware of this training within the government going on in your country? And I suppose just general thoughts and reactions to that suggestion. Thank you.
Yes, I see Marie, please.
Yeah, I think this is a very important question, so thank you for asking. I'm going to share a short story. In 2008, there's been a commission here in Quebec that really looked at the living condition of older persons, and there's been a lot of interviews done by the minister on what we're going through older person. And I have to say that for the first time of our history, we had a minister full-time responsible for seniors, which really made a difference. And one of the 10 major problems that came out, in the words of older person, but also in the words of researcher, was the importance of countering abuse and neglect. And I was invited to work with the government at that time. And I think that that was a very important experience, because we really had to raise awareness in the senior secretariat about what was abuse and how can we have policy informed by research results and also by what we know in the field of practice. So it's been a major dialogue to be certain that everybody was talking about the same thing, like having a strong definition, knowing what are the risk factors, knowing also what can we promote and how can we implement new social policies and do follow-up. Because one of the things I didn't say in my talk was the importance also to evaluate the effects of what we're doing. So when we're putting a new policy, it has to be informed by research, informed by practice. It has to be a dialogue between practitioners, government officials, and researchers. I know it's not the case everywhere, but I think this combination can be very rich. And then we all know that we have to review our policies every 5 years or 10 years, because all that will evolve, and we always have to keep ahead of what is coming.
Thank you. I see Amalia aussi.
Yes, I would like to stress one thing. You know, when we started with empowering people with the problem of Alzheimer's diseases and other these things, we are talking a lot about this, especially with the clerks in the local community, to empowering them how to deal with the people with dementia, you know. And when we started talking about this, then from bottom up goes the voice of those people and announce to the political decision makers that that's the problem, not only with the people with dementia, but with a lot of older people, because they are not used to have new IT devices or smartphones or other things. They need direct contact, people to people, not like we make this now. And I think that the training of decision makers is very, very important.
Yeah. Any other reactions? If not, Kristen, maybe you could check if we have another question from participants or comment. We have about 2-3 more minutes.
Sure. There was one other comment, you know, pointing out the fact that we have robust systems in place around child protection and also policies and protections in place around gender-based violence, but that these don't necessarily exist when it comes to the abuse of older persons. And so, you know, I think as Marie pointed out very nicely, that older people aren't all vulnerable and they don't have the same vulnerabilities, for example, as children, but there are certainly lessons that we can learn from responses to these other groups. So I suppose quickly, if anyone would like to respond to a question around, you know, are have there been lessons learned from protecting and addressing violence against other groups in your countries?
So I think if you want to make a progress in this field, I think at least Serbia, you need to kind of connect the issue with the domestic violence, and the progress in domestic violence regulation was actually made through gender-based violence and child protection. So this is something that you kind of need to lean on, but the difference is that the phenomenon is not the same. So you need to have this kind of more nuanced approach and really try to figure out all these kind of intersectional issues that will raise with you think about the potential risk of abuse and how to prevent it.
Thank you. Any other questions? If not, yeah, Marie.
Yes, sorry to come back, but 2 or 3 years ago with WHO, we did a study trying to see how can elder abuse be how is it or not a global priority in the country? So is it a political priority? And Yangji was part of this study, so Yangji will be able to talk about it maybe later on. What was our surprise is that almost every respondent said that if we compare with attention given to children or attention given to violence against women, there's not much attention given to violence against older persons. So it's not a political priority. And there are several reasons for that. Ageism is one, but another one, and I think it's important to raise, is how can we learn to work better together, especially the field of violence against women and the field of violence of elder abuse, because it seems that it's not always very well connected, and we're kind of forgetting that women will become older women and so they will stay women. So, and these two fields can easily overlap, and we would gain because we know that a lot of progress has been made in the field of intimate partner violence or violence against women, and less progress has been made in the field of violence against older persons.
Yes, indeed. And also transferring some of the lessons learned in terms of empowerment, that would also be very beneficial, because of course there's also a much larger number of trainings, I imagine, that that can be drawn upon. And that brings me, if I can just ask a very brief question before we move on to Yongji, about the lessons learned, the evaluation. Often, of course, trainings may not be, it may not be very easy to evaluate the impact of a training, because we don't necessarily connect what participants have learned with the results with regard to older people or the number of cases that may have been detected thanks to it. But from your own experience of developing, running the courses, seeing how challenges evolve, there may be some ideas or thoughts that you have regarding the needs we need to address going forward. Marie, you just shared one with us already in terms of according greater attention to elder abuse as such, and also connecting trainings with other age groups or women, younger women in that case. Other insights that you gained in your work regarding, if you were to do the next training tomorrow, or if you had a chance to revise your training course, what would you add? What would you change? What would you strengthen? Maybe just very briefly, is there anyone who would like to share a thought about this?
Sorry, so I think that other potential stakeholders need to be involved and kind of educated. For example, like financial sector, they're not super obvious, but they're like super important, like bankers and all other financial institutions that work with all the people, money, pension, etc. I think they're important. I mean, and then the obvious one, like police, because sometimes you observe that they have pretty paternalistic approach to other people, and yes, so different groups will be kind of included in the response. But then we need to figure out someone who are not like usual suspects, like, but for example, like bankers. So those kind of issues, which is kind of specific to elder abuse, need to be kind of more explored and then work with. Yeah.
And
So spread the word.
Yeah.
And
Yes.
with children in school to speak about elder abuse and to speak about older people in a positive way.
Thank you. Now, let's wrap up our question and answer session in the interest of time so that we have enough time for Youngji to share. And maybe I can ask you at this point now, Youngji, to switch on your camera and join us. So Youngji Yan is technical lead on aging and health at the WHO Regional Office for Europe, and he has kindly agreed to be our discussant with the challenging task of pulling out some of the key messages of what came across the different presentations that you heard and the different discussion points we just had. So Youngji, over to you. Leave us with some key takeaways as you have experienced the very interesting and rich discussion so far. Thank you. You're muted.
Thank you, Lisa. Good morning, good afternoon, and good evening, dear colleagues, friends, and excellencies. It really is my privilege to be on the fly on the wall to listen to these very interesting discussions and to really take down all these notes on the key messages, the takeaways, to think about what we as the UN family can support one another working together, supporting our member states or countries, supporting and working together with civil societies and partners. And so I'm really pleased to share some of the takeaway message and action points. I mean, in a world where 1 in 6 older persons faces abuse annually, including in nursing home where 2 in 3 staff admitting to abusing older persons, confronting this topic is of great importance, especially within the context of SDG 16 and SDG 17, where we mentioned about partnership. I think a lot of us mentioned about partnership. Everyone has a role to play in preventing and addressing abuse. And our discussion today about awareness building, training programs, is really our collective responsibilities that we share to achieving this target of SDG 16 and 17. But, you know, beyond the stark statistics of 1 in 6, 2 in 3, it really is very important that we think about the human stories, the faces behind these staggering numbers. And I have one slide that I wanted to share to really bring this message to home. And this is Norma Marshall. She is a 94-year-old woman who faced financial abuse, and she lost all her life saving because she trusted one person. And yet her story has a silver lining, if there is any, that it really speaks to the importance of community support, the importance of our topic today about training. And it is because of a vigilant pharmacist who knew Norma very well, because she visited her community every day to see her pharmacist. And this pharmacist was trained, was attuned to the sign of abuse, and was sensed her distress and really took action. And with the quick thinking, the pharmacist really take prompt actions, summon help, which eventually led to the arrest of the perpetrator. So Norma's experience, you can take down the slide now. Norma's experience really is a stark reminder on the imperative need for a comprehensive training programs that we hear today that really equip not just professionals, but with volunteers, with all professions, and the communities with the skills to recognize and to respond to the subtle indicators of abuse, really fostering this collective responsibility to protect members in our communities. And when we mentioned it is our moral responsibility in our community to create a safe environment. This aligns very well with Claudia Mahler, the UN independent expert, who in her remarks mentioned about this effort to not only safeguard the rights of older persons, but to also cultivate this culture of respect, to care and support, and to have a dignified life in our communities. One of the recurring themes that we have heard every speaker talk about is empowerment. And Norma's really exemplified this because she actually refused to be labeled as a victim. Instead, she really embraced the title that she is a survivor because she really courageously spoke out against financial abuse. You saw in the picture, she was actually in a press conference talking about her story. And far too often, as we may know, stories of elder abuse remain untold, with those suffering feeling a sense of shame and really enduring the suffering in silence, feeling this stigma. And so I think this need for survivor movement is very evident, and we need to really empower older persons. And here, I really want to echo Amelia's powerful words and call for actions of don't be silent. You know, violence is an unfinished story. It's a never-ending story, as you say, Amelia, because we need to work together with the survivors, not seeing them as victims, but really resilient individuals in order to amplify their voice, really raising the awareness of abuse. And actually, by listening to the voices of the survivors, their stories, we can actually uncover the barriers to why they are not reporting abuse. And I think Marie mentioned in her presentations how important it is that we understand the factors, the barriers of reporting abuse. This can help us inform our training. And it is an iterative process that, you know, we talk about evaluations, Milutin and Natasha, that we need to come back again to evaluate what worked, what doesn't, how can we really improve. And so this proactive outreach that Marie mentioned, outreaching all professions to the communities, to older persons themselves, and also echoing Cynthia's presentations, really underscore the need to train from a diverse perspective. And it really goes beyond professionals to the general populations in our communities, like grocers, pharmacists, as we hear the examples earlier, dentists, handymen, where you hear examples from Malta, bankers, you know, Milutin, you mentioned, you know, bank tellers, hairdressers, postal workers who come in contact with older persons for them to recognize, to develop a relationship with the older people. Because the broader the awareness across various spheres of life, the greater the likelihood that we can identify, prevent different forms of abuse. I also really want to echo Lisa's message that while some online courses of violence is useful in raising awareness among social and health professionals, it's not sufficient. We have to have additional targeted trainings to professionals specializing in these areas, like working with the police. And so this proactive outreach and comprehensive trainings of professionals, volunteers, specialists, and members of the communities, we can really truly ensure that no one is left behind. As we hear about all kinds of interpersonal violence, and yet the priority, the attentions on older persons, it's sort of left behind. And I think this is something that Marie mentioned about ageism. I also wanted to underscore the message, the key message that Claudia and Marie mentioned, which is about the rights of older persons. We spoke a lot about empowerment. And I think centering one of the core part of empowerment is recognizing that older persons are capable individuals. They have the right to self-determinations. And I think this is fundamental. And we advocate this dual approach, as Marie mentioned, of empowering older persons, and also at the same time providing targeted protections for those in need or for those who are at risk. And here we need to understand who is at risk. And so I think the part about understanding research is so important about who is at risk. And it's also been mentioned by Marie that we need to strike a balance between empowerment and protections, because this ensures that safeguarding the rights of older persons while enabling older persons to actively participate in decisions affecting their well-being. Really also wanted to highlight Milutin and Nataša from Red Cross about the importance of the insights gained through research and development of training programs. You mentioned about knowledge and evidence base, and I think Marie also mentioned about, which is also needs to be informed by practice, because everything that we do needs to be based on evidence, because with this, then we can scale up, as we hear the examples of Red Cross Serbia, to scale this up to Georgia, to Kyrgyzstan, to the Western Balkan countries, to Moldova, to Ukraine. And here I'd like to, very pleased to share that under the UN Decade of Healthy Aging, WHO and partners have identified 5 key action areas to combat against abuse of older persons. Of the 5, I want to mention 2 that are really relevant to our topic today, which is to generate comprehensive data. Understanding the scope of the problem is essential for effective interventions. And here we are developing this evidence gap map where we collect all the systematic reviews on prevalence, risk protective factors, consequences, and interventions. And these gap maps will help us in strengthening our training programs. The second one is about a project that we're endeavoring now, which is about cost-effective interventions called Interventions Accelerator, where we are expediting the development of effective interventions to create a whole portfolio of approach in various settings, including evidence on various training programs with the idea to scale them up. And I see that we're running short on time, so I'm going to end it here just to say that, Norma's stories and countless of others really highlights this urgency for our missions to come together. And we really do have this responsibility to end abuse of older persons, to partner together. And I know that we can really make a lasting impact and to ensure that our effort become the legacies to eradicating abuse of older persons.
Wow, thank you, Youngji. I think you did a fantastic job pulling out the richness of the messages that came from our presentations today. I'm sure many will feel the same when I now just want to thank all of you for sharing such rich, very concrete recommendations and examples. It is encouraging to see what good practice is out there. And now, as we heard earlier from Milutin, we need to scale it up. We need to spread the word across other groups so that everyone in society will know what elder abuse looks like and what to do when you see it. And I really thank each and every one of you for participating in today's event and for your very insightful experience exchange. I would like to inform you that we have set up an email list for those of you who may have heard about this event through social media or from colleagues. We just posted it in the chat. So if you would like to subscribe for updates for any future policy dialogues on aging, then please feel free to do so. Now, I also would like to very heartily thank my team, and in particular Kristen, who has been really in the leading driving seat in organizing this event for the past few months. And without you, it wouldn't have happened. Thank you so much, Kristen. And now, last not but least, for all participants who have joined today, whether you were coming through the regional forum on sustainable development, or the Standing Working Group on Aging, or civil society, or from somewhere else. Thank you so much for being part of today's event, and I hope you took away some good, urgent calls to action to talk about elder abuse around you, to take a look at some of those resources. And so finally, before closing, we will share all the presentations and resources that were shared in the chat with you after the event on the meeting webpage. So you will, I think, in the next few days find all the documentations there. There were a few questions in the chat about that. So thank you so much, and wishing you all a good rest of the day, the morning, the evening, wherever you are. and hopefully see you next time for our next discussion on aging.